after onset of stroke, every minute there are millions of neurons which are dying. We have to remember that the time of treatment is essentially what determines the final outcome. So if we come across anybody with any of these symptoms, seek for medical help almost immediately. So today I will be talking about stroke. We all know stroke is a very debilitating disease and it can affect almost everyone. It is more common in older age group, but as with the modern lifestyle and less of physical activity, it is also seen in younger age group. What are the risk factors for stroke? A very common risk factor today is lack of physical activity. We prefer to stay at home, watch TVs or movies, and there is less of physical sports involved, less of physical activity involved. All this has led to increased incidence of stroke. Other causes which may be such as smoking is an important risk factor of a stroke. Other comorbid conditions such as hypertension and diabetes, if they are not managed properly or inadequately, then it can also lead to stroke. So we have to focus on having a healthy diet and good physical activity and avoid unnecessary addictions such as tobacco and smoking. Coming to the treatment part of the stroke, today there are a lot of treatment options available for stroke if it can be identified almost immediately. So within 6 hours and in some cases up to 24 hours, there are option of dissolving the clot within this blood vessel. This can be done by a simple injection through the vein. This will remove the clot and then the blood flow is established. In some cases where the clot is long or there is a major artery which is occluded, there is a modern treatment which has come up recent years which is known as mechanical thrombectomy. Basically in mechanical thrombectomy, a stent-like device or a suction tube which is taken into the blood vessel which is blocked, and then by use of the stent or the suction catheter, the clot is removed. It is shown very dramatic results in large vessel occlusion, which in previous years were considered to be significantly life-threatening and causing severe disability. Next question is, how do we identify stroke? It's important to identify stroke and seek for medical attention almost immediately, because after onset of stroke, every minute there are millions of neurons which are dying. The recovery is much better if the stroke is identified early and treated early. How to identify stroke? It is given by an acronym such as F.A.S.T, where B stands for balance. If you find somebody who is not able to hold on to his balance, it may be stroke. E stands for eyes or vision. If somebody is having a transient loss of vision or he is not able to see properly or there is blurring of vision, it could be a symptom of stroke and we should seek for medical attention almost immediately. Next is F. F stands for face. If we see anybody with asymmetry on the face which was normal before, or his smile is kind of tilted or the angle of the mouth is tilted, it can be a sign of stroke. Arm. A stands for arm, where if we shake hand and his arm grip is not adequate or the arm grip is weak, he is not able to move his arm, it can be a symptom of stroke. S stands for speech. That means if somebody who was speaking normally is not able to speak, or his voice is changed, or he is not able to articulate his words properly, it may be a sign of stroke. The last word is T. The T stands for time. If you find anybody with all these symptoms, then it could be a stroke and it is time to seek medical attention almost immediately. We have to remember that the time of treatment is essentially what determines the final outcome. So if we come across anybody with any of these symptoms, seek for medical help almost immediately.